Many Johnson County families are facing childcare challenges as the COVID-19 pandemic continues. On this episode, hear from our childcare program expert and a local provider to discuss some of the difficulties with keeping kids and staff healthy and facilities operating.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Theresa Freed, a Johnson County resident and employee of Johnson County government. Many working parents of young children are having a tough time right now. The rise in COVID-19 cases in our community is taking a toll. With quarantine and isolation requirements and a highly transmissible variant out there, child care facilities and parents are struggling. Here to talk more about that, we have with us Eldonna Chesnut. She's the Johnson County Department of Health and Environment Child Care Licensing Division Director. And we also have with us Lisa Heinbach, a local child care provider in Shawnee. Thank you both for being here.
Thank you, Theresa.
Here. All right, just to start off with, I'll have you kind of introduce yourself and your role. Eldonna, if you want to begin with kind of what you do for Johnson County, and then also if you can describe the division of responsibilities between Johnson County and the Kansas Department of Health and Environment as it pertains to child care.
Sure. Thanks for having us, Theresa. So basically, as she said, I am the Division Director of Child Care Licensing, and our relationship with KDHE, so essentially we are contracted with the state so that we are essentially the boots on the ground, I guess you say. We do the regulatory work at the local level. So we are there to support the providers, answer their questions, do their visits, do everything like that, and then everything is sent up to KDHE visit-wise for them for any enforcement actions or anything along that line.
Okay, and Lisa, if you want to talk a little bit about your facility and your role.
Good morning, my name is Lisa Heinbach. I am the Goddard owner here in Shawnee, Kansas. We work with children ages infant through 5 years of age and have about 140 students at our school. So thank you.
All right. Well, thank you very much for being here once again. So, the big topic of conversation right now is we've got this Omicron variant in the community. It's very transmissible, and I just can't even imagine the struggles that providers are going through right now, trying to stay in operation and then keep their staff healthy and help with the kids staying healthy. So maybe we'll start with Eldonna. Can you talk about what you're hearing from providers in terms of what they're experiencing?
Sure, thank you. So yes, we had a provider meeting just a few days ago, and we get phone calls all the time. So yes, definitely, which I'm sure Lisa can attest to it. It's horribly stressful. It's horribly stressful for providers because they're kind of getting it from both sides, you might say. They're trying to keep open. They're trying to keep the kids safe. So they're getting hold of us and we're trying to give them best guidance, evidence-based guidance on what to do. But then they're also getting pushback from the parents. So I think it's just, everybody is just maximum stress level right now, just trying to do the best we can, hoping that we're getting closer to being done with this.
Yeah, as a parent of young children, I'm on a lot of social media groups where I'm seeing conversations about these challenges. And of course, you're hearing it directly from your parents. Lisa, do you want to talk a little bit about, as a provider, what are you experiencing?
Yeah, and I'd agree with Eldonna. We want to do the best thing for everyone, right? We want our students to stay healthy and well. We want our parents to be able to be at work and do what they need to do and keep our doors open, right? And yet we're faced with, like you shared, a variant that's really contagious this go around. And so it's just been challenging to do that well. And so trying to do the best we can.
And so the pandemic, it feels sort of never ending at this point. And I know like safety precautions and things like that have evolved as we've moved through this. So what does that look like in a facility? What are some of those safety measures that are taking place?
So from our standpoint, what we try to do is whenever a provider calls and says they have a positive case, we try to go through with them, okay, who was exposed, who was masked, who was, who was there. We try to give them as much flexibility as possible. One of the things we've done in Johnson County that not all of my peer counties have done is called cohorting. And so if their facility reports one case, but there's no other children positive in that classroom or symptomatic, and especially if it's an external exposure, meaning that the child probably caught the virus from somebody outside the daycare, then we do allow that facility to keep that room open. We do encourage them to make sure their parents know about that, know what to watch for, really be assessing those kids for signs and symptoms. And then, unfortunately, if there is 2 or more cases in the classroom, especially if it's deemed to be internal spread, then for the health and safety of those children, we do ask to close that classroom down. And as you're so right, things change so frequently with I can't believe it's only been 2 years, but we do try to give them as much flexibility as possible. And now with the new guidance, they were out for 10 days. If you're a positive case, you're out for 10 days, your exposures are out. And we're able to help out with a little bit on that from 14 to 10. And okay, well, they can test at day 6. And if they're asymptomatic exposure and they get a negative test, they can come back at day 8. And then now with the 5 days, so it really kind of depends on the age of the kids and if they can mask. Because if we can get everybody masked and a quality mask, and we can get them to be able to wear their mask well when they're old enough, then we can keep those kids in the facilities and keep them safer. However, with the younger ones that are totally unable to mask and unable to vaccinate, then we have to be a little more stringent in our recommendations. So I think, it really, I think it has helped with kids being able to get vaccinated now because we're able to keep them in the facilities without having to say, okay, everybody out, we're able to give more options to continue to come to care.
And so Lisa, do you want to talk about how
Sure.
the quarantine and isolation, all of that impacts from an operating perspective, but then also how does that impact the families?
Yeah. And so a couple of things just that we're doing at our school to try and minimize it is, I think the biggest thing that's been helpful is that as a community, and I mean my parents and my teachers, just communicating early signs of illness, right? And they let us know here in the front office, and we really walk through the next steps because as proactive as we can be to keep it out ensures that we're able to keep our rooms open. And so just my community of families and staff have done an amazing job of that, and I'm thankful for it. And then, of course, we are taking temperatures. We're doing the rigorous cleaning that childcare centers are known for. We're strongly recommending that those who can mask, following the guidelines of the health department as well. And to Eldonna's point, just thankful that they have really worked with us as a county and locally to address the problems and challenges. And I think it has helped us keep classes open in the midst of this. So thankful for that. Eldonna takes our calls at all hours and will specifically look at each classroom and what is occurring and help us make good decisions.
So when a facility has to close a classroom, what are the options available for parents?
Well, from our standpoint, like I say, that's kind of, we really try not to close if we don't have to. We don't want to make that recommendation. And anytime we do, it's not taken lightly. It's usually in consultation with a couple of EPIs and disease investigators and everything. We're trying to go over all the options. But from our standpoint, when we make that recommendation to close the room, that means that those families should be staying home. If the room has to close, that's a serious move. And that means that those kids shouldn't just go on to another daycare center. They shouldn't go on to out running around, going to mall or whatever. And they should stay at home and they should be quarantined, because that's kind of the intent. We're really trying to break that chain of infection. And that's one of the concerns that we actually have is that, okay, the room's closed, but now where are these kids ending up at? So we really want to get that message across is if your child's room gets closed, please keep those kids at home and quarantined.
Yeah, I imagine that is a very challenging thing for parents. I have a 4-year-old and he's in preschool half day, and he wears his mask as best he can. But when kids are that young, it's hard to always enforce those safety precautions. I can't imagine, the difference between like when my 9-year-old was a toddler or a baby in a daycare facility. You just kind of live with the fact that kids get colds and those are contagious, and that's the way it is. But at this day and age, if a child shows a sign of a cold, what do you do? Like, is it passed off as a cold, or do you say as soon as I start seeing a runny nose, that's time to take action?
Just like Eldonna works with each center, Eldonna and her team, I should say, works with each center so well to look at each situation. We do that with our families as well, right? So that's why we communicate out, call us first, and let's walk through symptoms, and let's walk through the history of allergies that with your child, or what else may be in the home or going around, and really lean into working with our pediatricians as well, and realizing that we don't jump right away to say that all things are COVID, because there's a lot of other illness going around, and trying to be very wise in next steps to the best of our ability. It's not going to be perfect, but I think just communication is the key through it.
If I could add on to that, I think that's a really great point, because we get so caught up in COVID that we forget other diseases are still out there. And especially now we're into the flu season as well. So, we do want to encourage folks to remember that unfortunately, flu and COVID have a lot of similar symptoms. So that a lot of times if they are testing for one, to test for the other, and that will help their daycare facilities as well know if it's something contagious that they need to be aware of and addressing, or if it's just a cold.
And so next, I just want to look at sort of the landscape of childcare in Johnson County. What are we seeing in terms of trends? Are people, the providers, are they getting overwhelmed and closing down because there's just so much to deal with? Or are we seeing more of them popping up, or what are we seeing?
Well, I'll address the first part. So we continue to have new applications coming in, both centers and homes, and probably not as fast as we did pre-pandemic, but we are still seeing new applications. In fact, just today, this week, I've had 2 requests for new center meetings. So that's good for the county. We overall are seeing a small decrease in the total number of facilities that permanently close, but that's very few that in the past 2 years even that have permanently closed. As far as the center standpoint, our homes open and close all the time. So I really am not connecting that 100% to COVID. I think there's a lot of reason that home providers open and close. It could be that they retire, they are moving, they're changing houses, and they have to have a new license. So I really think that, well, yes, we've had several temporary closures, especially on the home side, because if that's where they live, that's where their daycare is. So if they have a positive case there, it's more likely that they'll end up having to close their facility, for 5 to 10 days, just because it is their home as well. Where the centers have a little more flexibility on that. They're able to do a room or 2 at a time versus having to close a whole center. Now, that said, we have had, in just this week, I think part of it is we've been doing this for 2 years, we're tired, and there's a staffing shortage, and people are worried about their own health plus everything else. So we have had in the past week a couple of facilities that have said, we're just going to take a short break. We have very few kids coming. We have a lot of people out sick. We have staffing shortages. So we're going to close for a week or 2 weeks. But I think that it's not widespread, which is good. So in pre-pandemic, we had definitely tons of openings for childcare. And not to say that we don't now, it is getting more difficult because of the staffing shortages as well as the disease rate at this point in time.
Another trend I'm seeing, or at least some conversation, is that providers are in a position where they're raising rates, maybe because of the increased costs associated with all the safety precautions and operating. Can you talk about that? Are you seeing that?
On a annual basis, one of our resource and referral agencies, Daycare Connection, they do an annual survey, price survey, and it's for daycare homes. It doesn't hit the centers, but they do survey all the centers, and then they will say, well, here's what in the school district, here's the average price. So it will be interesting to see this year if there's any changes on that side. But from that, pretty much back to Lisa for the rest of that.
Teresa, you're absolutely right across the board. I think with other centers in my area, that is something that we've all had to do because of the rising costs. A lot of our supplies that we get to run have doubled in cost, if not tripled. And then probably the most significant, that is the greatest cost to all of us, is the staffing. And that has increased significantly as well. So in order to make sure that we remain open and are able to provide the care that we do, we've had to do that.
And so on the other side of that, are we seeing, as a response, are we seeing more parents making that tough decision about maybe one parent is a stay-at-home parent so that we're not using childcare any longer? Are you seeing any of that?
On my end, at least, I've not seen that be what's happening. Actually, the need for care, I am turning away a lot of families because my next available opening is so far down the road. And I feel really bad because I just realized that I think finding care is challenging.
What resources are available for parents who are running into this issue where they're not able to find childcare like they typically could?
So yeah, I think that, to answer your question directly, the resource and referral agencies, and we have two in our county that work with us, Daycare Connection and the Family Conservancy. And when I spoke with Daycare Connection, there is still a lot of openings, especially they deal mainly with homes, and there's a lot of openings, but the problem is it's not always where the parent wants it. Now, some of our really good facilities, they'll have a long waiting list. But you've got that's kind of where the challenge is, because in Johnson County, we have nearly 1,000 facilities in our county. So, and that's gone down some. It's gone down. When I first started about 20 years ago, we were at 1,300 facilities, and we're down to close to 1,000 now. But I think the biggest challenge on our county pre-pandemic was it just wasn't where they wanted it at. And now I think it is more challenging, as Lisa mentioned, that the fact that some facilities aren't taking new kids. We have some of our facilities that are connected with businesses that have told me, we're only going to take just employee kids right now. So it is becoming more challenging right now due to the pandemic. But I really feel like once we get out from under that will lessen. So to circle back to your direct question. So right now, if parents are looking for care, they should contact the resource and referral agencies. And again, you can Google their phone numbers. They're on our website. If they're both Daycare Connection deals mainly in homes, and their database is set up by school district. So if somebody says, I'm looking for daycare home in the school district, then they'll be able to provide that. Family Conservancy is main office in Wyandotte. They have a satellite office here to serve our county as well. And their database set up just a little bit differently. But again, the parent would say, here's what I'm looking for. I want a home, I want a center, I want this location, I have a child this age group. And then they're able to give them a list of facilities that the parent then can reach out to. The challenge is, of course, keeping everything current right now, because if both R&Rs do check in with their facilities and say, how many openings do you have, what's going on, and trying to keep current. But with things changing so fast right now, and especially with a room could be open today and closed tomorrow, it is making it quite the challenge. But I think that's still the best way to go. And we do careful about social media. I guess I would say we don't We don't encourage parents to just go on and say, oh, hey, I've got this childcare, come to me, because there is illegal childcare. And basically what that means is in Kansas, you have to be licensed to provide childcare. And that's 2 or more children, greater than 20 hours a week, total care. And so if somebody just says, okay, I'm just going to start caring for kids, the safeguard is gone for the parents. Because when you're a licensed facility, you have my staff coming in on at least a yearly basis. We do an initial visit where we look at everything, all the regulations, and they're all health and safety based. And then, of course, centers too, they get the same thing. If there are problems, if there are things that we're in non-compliance, we're back checking on that. And then, of course, the complaints, anytime that a parent or a neighbor or a repairman, we've kind of gotten them from everywhere, sees anything that concerns them, then they contact us, and then we're going to go out and investigate that. So with our whole role is make sure that the kids are a healthy, safe learning environment. So when when a child goes to an illegal care, you've kind of removed all of those safeguards on the parent side.
All right, that's some good information. And just as we wrap up today, we want to give our listeners some hope that things are going to improve. I know nobody knows when the pandemic itself will end, and we just know a lot of parents are struggling right now to deal with this very important issue. So in addition to the referral resources that are available, what additional support might be available to parents?
I guess from the standpoint of where we as licensing deal with parents would be, if a parent calls and says, I'm looking for daycare, we're going to refer them to the resource and referral agency. If they have a question about their daycare, then we're going to talk to them and help them to understand that. So from our standpoint, we're supporting the providers. So if a parent says, well, my daycare said I couldn't come to care because of isolation, quarantine, whatever, we're going to review those guidelines and help them make sure that they know that, what's going on with their daycare. Again, a licensed facility gives parents more safeguards than a unlicensed facility. So from our standpoint, that's probably pretty much how the contact we have with parents is when they call in. I think some of the centers do newsletters and they're communicating. So I don't know exactly what all centers do. So I don't know if there's anything else that you would want to add on that, Lisa.
Yeah, I mean, just in the midst of this, how do we support our families? We just continue to work as a team and communicate through it. And I would say through the course of the majority of COVID, we've been able to remain open and running and thriving, and really ensuring that our kids feel the least amount of impact through all this, right? That's the main goal. And then our families as well. So I'm hopeful in the days ahead that we're going to start seeing a return to normal. And so I don't know, I guess I don't think we're too far from that.
Let's certainly hope. Yeah. And we will have some information on the show notes of this episode about where parents and providers can go to reach out to Eldonna and her team to get more information about those safety measures that are in place and providing reassurance, and then also those resource and referral guides that can help parents and providers as well. Well, thank you both for being here today. Hopefully this information is useful to our listeners, and thanks for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.